Capgras Delusion is a psychiatric disorder in which a person holds a delusion that a friend, spouse, parent, close family member, or even pet has been replaced by an identical imposter. The Capgras delusion is classified as a delusional misidentification syndrome, a class of delusional beliefs that involves a misidentification of people, places, or objects. The delusion most commonly occurs in individuals diagnosed with paranoid schizophrenia, but has also been seen in those with brain injuries and dementia. It often presents in individuals with a neurodegenerative disease, particularly at an older age. No definitive impairment has been found to explain all cases of Capgras syndrome. However, it is generally agreed that the delusion has a complex and organic basis, caused by structural brain damage. Research has shown that the disorder may come from a combination of frontal lobe and right hemisphere brain damage. The frontal lobe damage causing problems with familiarity, and the right hemisphere damage causing problems with visual recognition. This would lead to the experience of recognizing someone, but feeling like something isn't quite right about them. Other research points to a disconnection between the temporal cortex, where faces are usually recognized, and the limbic system, which involves emotions. It has been shown that, while the person does recognize the face of the so-called imposter, the body does not have the same emotional response that it should have when interacting with a familiar person. Because it is a rare and poorly understood condition, there is no definitive way to diagnose the Capgras delusion. Diagnosis is primarily made upon psychiatric evaluation of the patient. Oftentimes they are brought in by the very person that they believe to be an imposter. Generally, treatment is therapy, often with the support of antipsychotic medications. Capgras syndrome is named after Joseph Capgras, a French psychiatrist who first described the disorder in 1923 in his paper explaining the case of a French woman, Madame Macabre, who complained that doubles had taken the place of her husband and other people that she knew. The syndrome was initially considered to be a purely psychiatric and female disorder, often noted as a symptom of hysteria, which we know now is not the case. However, it does occur more frequently in females.